Across continents and cultures, elder abuse remains a silent crisis, often hidden behind closed doors. Vulnerable older adults face neglect, exploitation, and harm, frequently at the hands of those they trust most. Despite its devastating impact, global awareness and intervention efforts remain inadequate. In this video, we'll unveil the true scale of elder abuse, explore its many forms, and discuss why urgent action is needed to protect our aging population. Let's begin by understanding what elder abuse really means and why it's a pressing public health issue worldwide. Elder abuse is a pervasive yet often invisible global crisis that transcends geographic, cultural, and socioeconomic boundaries. It's defined as a single or repeated act, or lack of appropriate action, occurring within any relationship where there is an expectation of trust which causes harm or distress to an older person. Elder abuse generally falls into 5 categories: physical abuse, emotional or psychological abuse, sexual abuse, financial abuse, and neglect. Victims often experience multiple forms of abuse at once, making detection and intervention even more challenging. Elder abuse is not just a personal tragedy, it's a significant public health issue. Globally, about 1 in 6 adults aged 60 and older experiences some form of abuse. As the world's population ages, with the number of people over 60 expected to double to 2.1 billion by 2050, the number of victims will rise dramatically. The consequences are severe, affecting physical, psychological, financial, and social well-being. Victims may suffer injuries, cognitive decline, depression, financial exploitation, and even premature death. Addressing elder abuse is crucial for healthy aging societies. Elder abuse takes many forms. Physical abuse involves the use of force that may result in injury, pain, or impairment, such as hitting, pushing, or inappropriate restraint. Emotional or psychological abuse inflicts mental anguish through threats, humiliation, or intimidation, often leading to distress and reduced self-esteem. Sexual abuse is any non-consensual sexual contact, including unwanted touching or assault. Financial abuse is the illegal or improper use of an older person's funds or assets, while neglect is the failure of caregivers to provide necessary care, such as food, shelter, or medical attention. Recognizing elder abuse is often difficult. Limited awareness, fear of legal consequences, and poor communication between older adults and their families are major barriers. Stigma and dependency on abusers can prevent victims from speaking out. In many cultures, discussing abuse is taboo, further hiding the problem. These barriers mean that elder abuse is frequently underreported, and the true scale of the issue is likely much greater than official statistics suggest. Better understand the global burden of elder abuse, researchers conducted a systematic review and meta-analysis, searching multiple databases for studies published between 2000 and 2025. They included only observational studies with participants aged 60 or older, using standardized definitions from authorities like the World Health Organization. The quality of each study was assessed using the Joanna Briggs Institute tool, ensuring reliable and generalizable findings. Researchers identified 990 articles from electronic databases, registers, and other sources. After removing duplicates and screening for relevance and quality, 94 studies from 35 countries were included in the final analysis. These studies represented a wide range of settings, from community-based to institutional environments, and covered diverse geographic and economic contexts. Most studies focused on individuals aged 60 and above, with sample sizes ranging from under 100 to over 500,000 participants. Meta-analysis estimated that 27.6% of older adults worldwide experience some form of abuse. This means more than 1 in 4 seniors are affected. The prevalence varied widely, from as low as 0.7% in some countries to over 90% in others, reflecting differences in reporting, cultural norms, and study methods. Emotional and psychological abuse was the most common, followed by neglect, financial exploitation, verbal abuse, physical abuse, and sexual abuse. Emotional or psychological abuse was found to be the most prevalent type, affecting about 21% of older adults globally. This form of abuse includes threats, humiliation, and intimidation, which can have lasting effects on mental health and self-esteem. Emotional abuse is often harder to detect than physical abuse, but its impact can be just as devastating, leading to depression, anxiety, and social withdrawal. Neglect, the failure of caregivers to provide necessary care, was the second most common form of elder abuse, with a prevalence of 19.3%. Neglect can include not providing adequate food, shelter, medical care, or protection. It often goes unnoticed, especially when older adults are isolated or dependent on their caregivers. The consequences of neglect can be severe, leading to deteriorating health and increased vulnerability. Financial or material exploitation affected about 11.7% of older adults in the studies reviewed. This type of abuse involves the illegal or improper use of an older person's funds, property, or assets. It can include fraud, theft, or coercion in financial decision-making. Financial abuse can devastate an older person's independence and security, often leaving victims unable to afford basic needs. Physical abuse, such as hitting or inappropriate restraint, was reported in 7.9% of cases. Verbal abuse, which includes spoken words intended to inflict emotional pain or fear, had a prevalence of 11%. While physical abuse is often easier to identify due to visible injuries, verbal abuse can be just as harmful, eroding self-worth and increasing isolation. Both forms require vigilant detection and intervention. Sexual abuse was the least prevalent, with a pooled estimate of 1.5%. However, experts believe this number is likely underestimated due to stigma, shame, and fear of reporting. Sexual abuse includes any non-consensual sexual contact, unwanted touching, or coerced nudity. Even though the reported prevalence is low, the impact on victims is profound and the true scale may be much larger. Prevalence of elder abuse varies significantly by region. Upper middle-income countries reported the highest rates at 37%, with South America, 42%, and Asia, 36%, showing the highest regional prevalence. These differences may reflect variations in reporting mechanisms, cultural norms, and socioeconomic stressors. In some regions, systemic inequality and fragmented elder care contribute to higher abuse rates. Elder abuse was more prevalent in institutional settings, such as nursing homes, than in community-based studies. Institutional settings showed a prevalence of 29% compared to 27% in community settings. Factors like staff shortages, inadequate training, and power imbalances can increase the risk of abuse in institutions. In the community, abuse is often perpetrated by family members or informal caregivers. Studies focusing exclusively on women reported a higher prevalence of elder abuse, 32%, compared to those including both men and women, 27%. This disparity may be due to gender-based power dynamics, financial dependency, social isolation, and longer life expectancy among women. These factors can increase vulnerability to abuse by caregivers or family members. Several risk factors contribute to elder abuse. Caregiver-related problems such as depression, burnout, and substance abuse play a significant role. Broader socioeconomic challenges like poverty, social isolation, and inadequate support systems also increase risk. Victims may be more vulnerable if they have cognitive decline, disabilities, or are dependent on others for daily care. Consequences of elder abuse are severe and wide-ranging. Victims may suffer physical injuries, cognitive decline, depression, financial loss, and even premature death. Abuse can also lead to social withdrawal, loss of trust, and diminished quality of life. The impact extends beyond individuals, affecting families, communities, and healthcare systems. One major challenge in understanding elder abuse is the lack of standardized definitions and measurement tools across studies. Differences in how abuse is defined and reported can lead to inconsistent results and make it difficult to compare findings globally. Underreporting, especially for sexual and financial abuse, remains a significant concern due to stigma and cultural barriers. Meta-analysis used rigorous methods to assess study quality and publication bias. Tools like Beggs and Eggers tests showed no evidence of publication bias, and sensitivity analyses confirmed that no single study significantly influenced the overall results. Most included studies were of high methodological quality, enhancing the reliability of the findings. Compared to previous reviews, this study provides a more comprehensive and up-to-date global estimate of elder abuse. Earlier studies often focused on specific regions or used outdated data, limiting their relevance. By including recent studies from diverse settings and applying strict quality criteria, this analysis offers a clearer picture of the current global burden. Wide variation in elder abuse prevalence, ranging from 0.7% to over 90%, can be attributed to differences in study design, definitions, sample sizes, and data collection methods. Cultural and societal factors also play a role, as some regions may normalize or underreport abuse, while others have better awareness and reporting systems. Economic disparities and changes over time further influence these rates. Abuse in institutional settings such as nursing homes is particularly concerning. Factors like staff shortages, inadequate training, and power imbalances can create environments where abuse is more likely. Institutional abuse often goes undetected, making oversight, staff education, and effective reporting mechanisms essential for prevention and intervention. In community settings, elder abuse is often perpetrated by family members, neighbors, or informal caregivers. Social isolation, financial stress, and lack of support can increase the risk. Community-based abuse may be harder to detect, as victims are less visible to authorities and may be reluctant to report abuse by loved ones. Findings of this global study reinforce the urgent need for policies to address elder abuse. International frameworks from the UN, CDC, and WHO emphasize the importance of protecting older people's rights, improving detection and reporting, and creating age-friendly environments. Policy reforms should prioritize elder protection, staff training, and comprehensive screening tools. Raising awareness about elder abuse is critical. Community education programs, media campaigns, and professional training can help break the silence and encourage reporting. Increased awareness can also reduce stigma, empower victims, and foster a culture of respect and protection for older adults. Effective prevention strategies include improving caregiver support, providing respite care, and strengthening social support networks for older adults. Regular screening for abuse in healthcare and community settings can help identify victims early. Policymakers should invest in training programs for caregivers and professionals to recognize and respond to signs of abuse. To improve global understanding and response, standardized definitions and measurement tools for elder abuse are needed. Consistent data collection and reporting will allow for better comparisons across countries and regions, helping to identify trends and target interventions where they are most needed. Future research should focus on refining definitions, improving reporting mechanisms, and exploring the long-term consequences of elder abuse. More studies are needed in underrepresented regions such as Africa to provide a truly global picture. Mixed method approaches can enhance the accuracy and applicability of findings, guiding more effective prevention and support strategies. Despite more than 1 in 4 older adults experiencing some form of abuse, the world has not given this issue the attention it deserves. As the aging population grows, the urgency of implementing stronger prevention strategies, policy reforms, and awareness campaigns cannot be overstated. Protecting older adults is a shared responsibility, Let's work together to ensure dignity, safety, and respect for all.